We will now move on to our 6.5, which is our 9:30 item. Consideration of update on COVID-19. And it looks like we have, let me see here how we have this going. We'll go ahead and give the floor to our public health officer and our public health director. I think, right?
Yes, I assumed that Director Portney wanted to make a brief introduction. There he is.
All right.
Yes. Good morning, Board of Supervisors. Good morning, community. Today is a special day for the health department and for our county. I'll leave introductions and direction moving forward to Dr. Pace. But I just wanted to pause and appreciate this milestone and transition. Dr. Gary Pace has been an advocate. He has been a leader, and he has been gracious in the time that he has spent with the county as serving as a public health officer. And we have been blessed, and we're grateful to transition into the new. And as Gary Pace departs, and we appreciate him for his service for the county, we also like to welcome Dr. Eric McLaughlin, who is going to be coming from working with us from Vegas to serve our community at large as our incoming public health officer. So without further ado, I will pass the mic to Dr. Gary Pace and allow Eric to introduce himself accordingly.
Hey, good morning. Thank you, Jonathan. Good morning, Mr. Chair, and to the supervisors and to the community. I'm Gary Pace, the interim public health officer here in Lake County, and going to give the COVID update. Kind of the way I was thinking about doing this was I'd give the update, talk a little bit about the future direction in dealing with COVID that the governor's talking about, try to clear up a little bit of the confusion around masking, and then kind of hand over the reins to Dr. McLaughlin, who officially starts today. So we'll kind of hold off. He'll be the icing of the cake at the end of the talk here. So first off, I want to take a moment and acknowledge just how hard the last couple of years have been, really. And, it was 2 years ago, right about now, that we were starting to hear about COVID. And the first shutdown started on March 17th. So, basically 2 weeks from now. And over 120 people have died in Lake County now related to COVID. And, my condolences to Supervisor Crandall and Supervisor Simon about the losses in their family. And, but also, there's been a lot of illness, a lot of lives disrupted, kids not getting the education that they normally get. And, it's just been a huge deal. And, especially feeling the recent loss of lives in the context now when we're talking about getting back to normal seems a little kind of hard and part of the conflicts that we're having with all this. And so, it's really been rough, I think, for a lot of folks. And so the latest surge is getting better, and we'll look at the data now. And to talk about that, thank you, Matthew, for doing this. So this is put together by Sarah Maricos, our epidemiologist, with one slide that I put in myself, so she might grit her teeth if she saw my version of it, but we'll get to that. So this is the current look in California. On the left is the case rate. You can see it's dropping down quite a bit. The death rate is starting to slow down, but as always, there's a lag time from the cases to the deaths. And then the testing positivity in California now is 2.9%. Next slide, please. So this is the health system impacts. This is really what we're starting to look at a lot now, is how to prevent overwhelm of the hospitals. And you can see at the right here that that's starting to drop off in California quite a bit. Next slide, please. This is Lake County, again, healthcare impacts. So the hospitalized patients on the left, the ICU patients on the right, dropping. It's always a little hard to gauge this because of the way our transport is, but anyhow, the curves are reflecting what we're seeing elsewhere. Next slide, please. This is the tests and the test positivity. So then the left is the number of tests, which, the numbers are going down, not too surprising. On the right is the test positivity. So you can see in Lake County, we're at 10.1 test positivity, and in the state, it's 2.3%. So we're still seeing a much higher, 4 times the rate of positive tests in Lake County as there is in the rest of the state. So that shows that we're still actively having community transmission. Next slide, please. This is the case rate and death in Lake County. Again, you can see the dropping and the positive trends overall. Next slide, please. So this is the one I put in. So basically what I wanted to do is just get a little context here on what we're seeing, and this can lead to a whole lot of conversation, but it just seems important at this point in the pandemic to pay attention to this. So on the left-hand side are neighboring counties here. The second one are the population rates, death rates, and the vaccination rate. And these are from different places, so the vaccination rate is not going to exactly correlate with what we see in our later data, but I got the graph off the state site and had all the counties at the same time. So if you look across at Lake County, we have 65,000 people, 128 deaths attributed to COVID, and then the vaccination rate is 54%. So Tehama County has a similar population, but the death rate is 30 people more. The vaccination rate is 10+% less. Mendocino County has 20,000 people more than we have, yet they have 16 fewer deaths, but a significantly higher vaccination rate. Napa County, twice our size, about the same number of deaths, but 20+% higher vaccination rate. Sonoma County, that's just 8 times the size of Lake County, but only 3-4 times the number of deaths, and the vaccination rate again is really high. So, there could be a lot of reasons explaining this, and we could spend a lot of time talking about it, but I think it's very useful to start tracking some of these things and seeing, especially Mendocino County, who's very similar to us in a lot of ways, and yet they have a much lower death rate than we have. Next slide, please. So these are the age group, the cases in February. The most important thing to notice here is if you look at the younger ages, there's 34 per 100,000 in the 5 to 11 and the 12 to 17. So these are the school age kids, of course. And then the next groups are the parents of the school age kids, or the folks that are working out in the community. So next slide, please. So this is, again, the age range. We'll go ahead and pass over this. This one's, go ahead, next slide, please. So this is the race and ethnicity issues. So if you look at probably the easiest way to look at this one is this middle, this first column here, February 1 to 27. And if you look at the percentage of cases in the white community is 60%, the Latinx community is about 26%, and then the Native American community is 10.6%. So this is roughly correlates with the percentages in the community. The Latino community is probably 20 to 22% of the population. The American Indian population is probably 4 to 5%. So, we're seeing some inequities here, some higher proportions in the Latino and the Native community, but it's roughly correlating with the population at this point. Next slide, please. So similar, this is basically illustrating the same thing. Next slide, please. So next slide, please. This is the vaccination coverage in the Lake County. And so basically amongst eligible Lake County residents 5 and older, not quite 2/3 of the folks are fully vaccinated. So this is, lower than the state. The state rate is about 70%. So this is an issue, and this is probably contributing to the higher impact of spread and the higher impact of the death rate. Right now, we are the 5th highest county in the state in terms of the number of cases per 100,000. So there's only 4 counties out of the 58 that are higher than us in terms of the number of cases per population. Next slide, please. This is by age group. So again, if you look at the kids, the 5 to 11 and the 12 to 17-year-olds, we're much lower than the state average. This line that goes down the middle is the state average. So those two, and then the 18 to 49-year-old, which tends to be the parents of the younger kids. So all these groups are vaccinated at lower rates than we would like and lower rates than we're seeing as the state average. I think that's it, though. So, thank you. So, I think overall we can see that things are getting better, but we're still dealing with a lot of cases here, and we are in kind of this tricky area of how to balance everything out. So I wanted to go into how we're looking at things moving forward, especially with the governor's discussion last week about all this. He's looking at how do we anticipate moving forward where we still are being careful, but we're preparing for future surges. Historically, the surges have been coming every 6 months or so since the beginning. So we've been having about 2 a year. And this next one may be coming at the end of the school year, or probably more likely end of the summer when we're starting to talk about going back to school. How bad is it going to be? Is it going to be a new variant? We don't really know. Was this one the last surge? I mean, eventually they'll probably stop. And so we don't really know any of this. And so I think our job in public health is to try to allow movement and as much normal life as possible while also trying to prevent the bad outcomes from coming. So, and I think really we actually have a lot of experience doing this in Lake County. If you think of the fires, we have to live during fire season all the time, where we go ahead and live our lives as best we can. But we also are kind of ready. If you start smelling smoke or you start seeing the smoke plumes, we know who to talk to and how to prepare. The red flag warnings, we're getting used to dealing with those. And so I think this is all very similar kind of approach, where you're living with a certain amount of caution and preparedness, but you're also not letting it completely suppress your whole form of life. So the governor's plan is to dial things down when the case rates are less worrisome, and then to go ahead and prepare and for when the surges do come and when we start seeing some changes. And one of the ways we're doing that is wastewater monitoring is going on now. So we are starting to monitor the sewage, because that's an easy way to pick it up really early, even before the cases start really spreading in the community. But the focus on preparations, the 3 things the governor's really suggesting is during the lulls, in between the surges, which is what we're entering into now, to stockpile testing supplies and PPE is the first. Second is to really try to get people vaccinated, especially those people in the most vulnerable communities. And there's a particular emphasis now on school-aged kids to try to get them vaccinated. And then the third piece he's really focusing on is combating disinformation, because there's so much hesitance in getting potentially life-saving vaccines and using safety measures like masking. So really starting to try to approach the disinformation tactics straight on. I want to talk a little bit about masking, because there's been a lot of changes in the last week or so, and it's somewhat confusing. So I just want to kind of highlight the main points and how to kind of organize the thinking about this. So again, just for context, there was a big study came out in the British Medical Journal. It was published in November of 2021, meta-analysis of 72 studies that showed that masks work. So from the data is very clear that masks do work. I think that's probably what we're seeing with the differentials between the counties, the vaccinations and masking. So in this study, they saw a 53% reduction in COVID infections attributed to the masks. And many other studies show similar findings. And of course, the quality of the mask matters. But this was a big kind of reputable study that is probably going to be setting the bar for where we're going. The CDC just came out with new guidelines on Friday. Some people are probably aware of that. The aim is to help communities live with the virus and get back to some version of normal while preventing severe disease so as not to overwhelm the hospital. So that's the big public health focus now. Not so much preventing cases, but it's we've kind of are moving past that and moving into a phase of really trying to prevent the severe disease that causes the hospitals to get overwhelmed and not able to provide care. This CDC guideline, so this is federal CDC, is really for individuals. It's not about how states or counties should move forward. So if you're an individual and you're not sure what to do, you can look at the CDC guidelines and get some clarity about what they think you should do. Basically, they're looking at each county's status in terms of risk, and then they make recommendations based on that. So if you're a medium risk or a low risk or a high risk county, based on the CDC's gauge, it tells you how to think about masking. And again, to emphasize, 70% of the counties in our country are at medium or low risk right now. Lake County is currently high risk and very, very firmly in the high risk county. And there's a map online, if you go to the cdc.gov or other places, that shows each county, and they're going to update it weekly, I think. So if you're in a low-risk county, there's no need to wear a mask. They feel that it's safe enough, the transmission rate is low enough that it's not necessary. This is masking indoors. Medium risk, if it's a medium risk county, you should consider wearing a mask if you're at high risk of getting severe disease. So if you're immunocompromised or elderly or something like that. And then if you're in a high risk community, which again, Lake County is right now, they recommend wearing a mask if indoors with other people. So that's the CDC guideline for if you are wondering about yourself or your family, you can go look at the CDC guidance. Under their guidance right now in Lake County, they would recommend wearing masks indoors around other people, whether you're vaccinated or not. Now, California came out with new guidelines last week, and they're changing some of it again today. So as of today, they've listed the indoor masking rule for unvaccinated people. So if you're in the state of California, the indoor masking guidance until today was if you were vaccinated, you didn't have to wear a mask indoors. If you were unvaccinated, you were supposed to wear a mask indoors. Today they've changed that. So in California, there is no mandate to wear masks indoors unless you're in a high-risk area, which is a healthcare facility, public transportation, correctional facilities, or homeless shelters. Or schools. Schools are the other ones, and we'll talk about that in a minute. But so basically, as of today, in the state of California, you don't need to wear masks unless you are in one of these higher risk areas. The exception is local jurisdictions can be stricter. So Lake County, we're following the state guidelines, which is pretty much what we've done since the beginning. So if you have a question about what to do in Lake County, you can look to the Cdph guidelines, the California Department of Public Health guidelines. And at this point, there are no indoor masking mandates in Lake County except for what the state guidance is, which is in these particular high-risk areas. Mendocino County, on the other hand, is continuing to require indoor masking. So I was up there this weekend visiting some friends, and when you go into a store or a restaurant, you're expected to put a mask on. And there's only about 3 or 4 counties in the state that are doing that, but it's part of the confusing puzzle that's here. So we have the federal, we have the state, and we have the local. So and they all kind of are doing different things, and it makes it a little bit confusing. But then there's the schools. The schools are a whole nother story. The schools in California at this point are mandated masking in the schools as part of a high-risk situation. After March 11th, just yesterday, the governor came out and said after March 11th, masks will no longer be required in schools or childcare settings. So that would be the end of next week. The masking mandates will be lifted for the schools and childcare settings. Local school districts can continue to mandate masks, and I'm sure that'll be part of the discussion in the coming weeks. We didn't really know what they were going to say. We just knew they were coming out with some guidance yesterday. So I know all that's fairly confusing, but hopefully that helps sort out the differing perspectives. So just a couple more things. I want to emphasize the importance of getting the vaccinations. Vaccination is really, really important. And at this point, with the surge kind of dropping down, it's a really good time to get vaccinated in preparation for the next time around. Vaccines are clearly the key for us decreasing transmissibility and preventing the severe disease, at least it has been so far. If you're having trouble finding where to get vaccinated, go to our website, Lake County Public Health, or contact us at the COVID Warm Line, and we can help point you in the right direction. The state is providing some resources with a community vaccination site, and there's some plans for targeting some of the school-age kids that are coming soon. But given the changes with the approach and how we're moving into this post-surge kind of model, some of these resources are going to disappear by the end of March. So I really encourage people, if you're needing to get vaccinated still, go ahead and take advantage of these resources while they're here. So overall, the push is to try to move forward towards a more normal lifestyle, but continue to be cautious and ready to ramp up as needed. So moving on to the next chapter here. So I'm really happy to say that, there's a new team that's come together in the health department. This is a really exciting and kind of an energetic, smart team that's committed to addressing the health needs in the county. And Mr. Portnoy, JP goes by right here on the screen, is going to be the leader and a very dynamic guy with a lot of ideas, and we're really lucky to have him. Eileen is our new director of nursing, who's been here maybe 6 months or so. She's got a lot of experience and really great. Mike Marsh is helping us with some emergency preparations, and there's going to be a new PIO coming in soon, a public information officer, and now Dr. McLaughlin, who's up here. So I want to say a few things there, but I also just want to acknowledge that there's been some really hardworking and committed folks that have been with the department for a long, long time and through this whole COVID surge. And, I really want to acknowledge all the work they've done and give my deep appreciation for all of that. And their experience and institutional knowledge is going to help with this transition to the new team. And I want to say personally how much I've just appreciated working with all the folks in Lake County during this incredible time. I mean, it's been pretty amazing, and we've gotten so much support from the county staff and from Carol Hutchison and Matthew and the whole team, and through the health department and all, volunteers, the MRC volunteers, folks coming out and helping us vaccinate, the different hospital and clinical settings around it, is the fire guys, it goes on and on and on and on, how much this has been such a broad community effort to really pull this whole thing along. And we don't get a lot of outside help usually, and people really step up. And it's been really a privilege for me to be here and be part of this, and so I want to thank you all. Now to Dr. McLaughlin. He's a really interesting guy, a lot of relevant training and experience with wildfire responses, and he's been around the world, different places, got a lot of experience with pre-hospital transport, and he's worked with public health in a lot of different settings. So he's bright and has a lot of energy, and I think we're going to be really going to see a lot happening here with him and JP working together. So today's his first day on the job, and I'm going to be around a little bit to help if needed, but I don't really expect too many calls. I think it's really, really incompetent hands here. And so I'm going to sign off and hand over to Dr. McLaughlin if he wants to say anything before we go to the board and the public comments. So thanks.
We have to give you a round of applause, Gary, for your service. So thank you. Dr. Eric, the floor is yours, sir.
Yeah, thanks. I'll keep it brief and really wanted to acknowledge Dr. Pace. Exemplary leadership in a truly arduous times, not only for public health, but for medicine and for our communities. He's been an incredible resource that I've been happy to take advantage of in my transition coming on. He's been a nice guy. He seems to take punches and hits and keep smiling. And I think that is probably what is one of the most successful factors that he possesses. He's been a wealth of knowledge to me, and I'm certainly keeping his phone number in my contact list should I need to phone a friend. I also wanted to echo his statements about the importance of vaccinations. He presented a slide that I think he was maybe a little flushed about when he put up during his presentation, and I thought that slide was very important. It showed what we see backed with science of death rates not only correlating, but causing death rates. We see communities with higher vaccination rates have less deaths. And I think that's an important take-home message. I think this is part of the impetus for some of the changes we're seeing and the shift to how we are fighting COVID as communities, as states, and as a nation. So I really wanted to draw further attention to that. I echo his sentiments on CDC and California Department of Public Health guidance. We're very appreciative to have that work being done, and we intend to follow those. So I really like, again, to thank Dr. Pace for his counsel, his guidance, his incredible stewardship during the very arduous last couple of years of COVID. And he's given me some big shoes to fill, and I look forward to the challenge. I'm incredibly excited to be working with our new team, Ms. Van Cleef, Mr. Portney, Ms. Hutchinson, Ms. Baker, a lot of others on the call that I may have hopefully not excluded too much of. And I really look forward to this opportunity, and I want to thank the trust the board has placed in me to keep people healthy and safe and get on with our lives and hopefully improve them. So I want to say thank you again for that. And again, Dr. Pace, cheers.
Welcome. All right, introductions are made. An overview of the health department, our current state of COVID has been done. And I would like to pass the microphone back to the Board of Supervisors.
Thank you, Director Portney, and thank you, Dr. Pace, for these years, and working with you has been a pleasure for me, not just here, but also when I was working simultaneously with the tribe. The help in that realm was a very big time, and it's something I'll always remember and cherish. And your availability, your empathy, your diligent work, greatly appreciated, and I'm glad that we have someone that you can pass that on to. Seems like he'll fill those shoes just fine, and I just want to thank you once again, and I'll go ahead and I don't know who was first, but I'll go with Supervisor Pyska.
Dr. Pace, thank you so much for your time here, and thanks for hanging in this last year. I know it was difficult, and you led with empathy and compassion and your heart, and we're always going to be grateful for your time here, and really, really thank you. And welcome, Dr. McLaughlin. I'm really excited for your first day, and we have a solid team, and so we're going into this new lull with a new team, and the support of the staff that's been here throughout the last couple of years. So it's a new day, and I'm excited, and want to just give one more thanks and shout out to Dr. Pace. Thank you so much.
I just want to make sure that I gave my thanks also to Dr. Pace for sticking with us for the last 2 years. We really appreciate everything that you've done for Lake County, and I believe we are better because that you were here to help guide us and protect us. So thank you.
Supervisor Sabatier.
Thank you very much. Before I get to Dr. Pace and Dr. McLaughlin, I want to talk a little bit about some of the information that was provided. One is last week I did a presentation on the data. All the data that I provided from Cdph was the correct data to provide. I accidentally said something that I shouldn't have said, which was off the top of my head, and that was the death rate for the flu. I said 0.1, it's 0.01, so times 10 on that information. But the main basic information I was providing was the Cdph data on case rates and death rates, and so all that information was correct as it was directly from there. So I apologize for that misinformation that was provided last week. week. I wanted to make sure and correct that because I do not want to make people believe things that are not correct. I also want to highlight some of the information that is available online at Cdph about vaccinations to support what is there. Number one, we've been talking about, and we've kind of been hearing that continuing to talk about vaccinations is useless. Those who don't want it aren't going to get it. And when you look at the state website, you still see the number of unvaccinated population decreasing on a daily basis. It's still happening. So I think the conversation still is relevant, and I think it's still useful. And I want to bring some of the data information that I obtained looking at our surge, even for Omicron, which many of us were led to believe that the vaccinations were becoming less and less relevant in protecting us. And while it might be less than before, it's still very relevant today. And so, for example, for the population of 5 million in the state of California that are unvaccinated, the deaths per 100,000 was 95, approximately 95. For those that are vaccinated, not boosted, just vaccinated, it was 11 per 100,000. And for those that were boosted, it was 4 per 100,000. Now, when you go from 95 to 11 to 4, that is a drastic, huge difference. And to me, that's data that shares that there is a level of protection that still exists, and it's still very relevant for us to have these conversations. Also, I wanted to touch on the information that Dr. Pace provided about kind of comparing us. And I'm not going to go too far because it's not a discussion we should have today, but I know that we've had discussions in the past about our health metrics. And I think our health metrics have a lot to do with how we cope and how we deal with COVID. We are one of the most unhealthiest counties in the state of California. That does not help us to have to be on the starting line of dealing with COVID to begin with. And I hope that one day we stop being reactionary to COVID. We were forced to. We couldn't ignore it. And that we can become proactive again in working towards better health metrics, which can lead us to better outcomes for everything, not just focusing on COVID. Because I looked at the map again of health metrics, and we're just a bright red.
Sorry.
We are a bright red county surrounded by other different colors of varying results of health metrics. We need to do better, and I hope that we can get back to that type of work. And I know it's difficult because, again, we can't ignore COVID. It's definitely been something for us to pay attention to. Dr. Pace, appreciate that we were able to keep you for the length of time that we lost you, we got you back, and I appreciate that. It's been unfortunately a long trek to be able to find ourselves a new public health officer to take your place. Appreciate that you have been a continuous rock, not swerving around public opinion, public the language and the comments that we hear every day during our meetings, that those things have not changed you from looking at the data and looking at the science. We can't have public health show us anything other than that. And then afterwards, we can make our own decisions afterwards based on the information provided. But that public health is science. It should not be changed based on public opinion or popularity of the content. So I appreciate you being very steady throughout these difficult times. I don't think we've ever seen public health be placed in such a spotlight and such a pedestal ever before. I don't even think the AIDS pandemic did what COVID did to our country and our communities in separating us and splitting us apart. So definitely a difficult time, both interesting and terrifying all at the same time to have to deal with it, not on the front lines, but as a leader making decisions, and those decisions matter. Dr. McLaughlin, welcome, and looking forward to you taking on the role of PHO and bringing us some of these changes that we're going to deal with to make our county a healthier county. And that's working with our hospitals, working with all of our health partners together, because we're not going to do this on our own. We're going to do it all together. So looking forward to it, and thank you for the presentation. And again, Dr. Pace, thank you very much for your service to this county.
All right. Thank you for that. Looks like we have All the board has spoke, and so we'll go ahead and open this for public input. My Zoom went down, so if you can assist me on that.
We have phone 4627.
Phone 4627, if you can unmute, and you have 3 minutes.
Hi, good morning, everybody. This is Tom Slade again. To take off what's where I left at public input, and I really don't like making these phone calls. I get kind of, it's, I'd rather call up and say nice things. I really would, but I noticed there's no mention of early, and what I'm going to talk about, I'll be very brief here, has been talked about numerous times at prior meetings. So no mention of early treatments like ivermectin, HCQ, even zinc and vitamin D. I just find it's irritating to me, but I guess I shouldn't use that word, but when people say, anybody who doesn't agree with one side, it's misinformation on the other side. So I'll just read this briefly. The unquestioning, from my perspective, the unquestioning lockstep COVID policy is the latest in a long, disgraceful Board of Supervisors history, and that's what I'm talking about from before, going back years. From my perspective, as a COVID exaggeration, discredited a PCR-based fear campaign, and major harm caused by politically motivated and imposed unwarranted rules crumbles, horrific vaccine injuries and deaths mount, and people realized they were duped, that the Board of Supervisors, despite all the information, including well-recognized life-saving treatments publicly disclosed to them at the Board of Supervisors meetings, have and will soon be recognized as a colossal, spectacular, tragic failure. And time, over time we'll find out. But I just want to put this out there. People can put whatever they want, but we'll see in time. So thank you. That's all I have. Bye.
Thank you for your comment. Is there another person that has their hand up?
Julia Bono?
All right, Julia, please unmute yourself, and you.
Hello, can you hear me?
Yes, go ahead.
My name is Julia Bono. I have degrees in scientific research. I'm here today to speak firmly against the use of mask mandates to prevent the transmission of SARS-CoV-2 virus that causes the COVID-19 disease. I am pleased to hear that mask mandates have generally been dropped in California, and I would urge Lake County to immediately follow suit in that regard and to eliminate school mask mandates immediately. In contrast to the single study Dr. Pace mentioned, my extensive research on this topic has turned up hundreds of peer-reviewed studies that show the surgical ear loop masks are generally ineffective against preventing the transmission of tiny virions, including those on the order of 0.125 microns like SARS-CoV-2 that can only be seen with an electron microscope. In addition, the mask packages specifically state that the product will not provide any protection against the COVID-19 coronavirus or other viruses. Even the better N95 face masks show limited effectiveness against COVID-19 due to its small size. Using and mandating the use of such masks to prevent COVID-19 is therefore not justified by science. Since the SARS-CoV-2 virus is so tiny, using a standard surgical face mask to stop its transmission is a bit like trying to stop a swarm of bees with a chain link fence. Not only are such masks ineffective against COVID-19, but various studies show they cause breathing issues, acne and headaches, reduce empathy and body language communication, have other adverse psychological impacts like causing excessive fear and result in antisocial behavior. Mask mandates are therefore especially unnecessary, odious, and heavy-handed public policy approach in response to COVID-19 that mainly serves to increase fear levels and reduce physical and psychological wellness among the population. Such policies seem especially problematic when valid peer-reviewed scientific research seriously questions whether the easily obtainable surgical face masks are actually effective in preventing the spread of SARS-CoV-2. Forcing healthy people to wear face masks when in public to prevent spread of a microscopic virus also contributes to a shortage of such masks for the very medical professionals who do actually need them to protect against transmitting bacterial infections. Also, I still hear vaccinations being pushed by Dr. Pace and Eric McLaughlin, but the reality is that they cause harm and have no effectiveness in preventing new COVID cases, so they give the vaccinated a false sense of security. The vaccines also have a higher death reported rate of roughly 87 per million than the current Omicron strain of the SARS-CoV-2 virus that only kills around 9 per million cases. Basically, unless you're over 80 years old or have serious diet-related comorbidities like heart disease, cancers, diabetes and obesity, or if you're a tobacco smoker, it does not make sense to vaccinate against COVID, since your odds of survival are generally greater with Omicron that confers lasting immunity against 6 structural proteins instead of just the single spike protein that the mRNA vaccines code for. You can also notably reduce your chances of suffering from chronic diseases and therefore from experiencing moderate to severe COVID by following a whole food
Finishing,
diet.
if you could finish up, yeah.
Okay. Again, I want to repeat my last sentence. You can also notably reduce your chances of suffering from such chronic diseases and therefore from experiencing moderate to severe COVID-19 by following a whole food plant-based diet. Thank you.
All right, thank you for your 3.5 minutes. Go ahead, Supervisor Sabatier.
I hope I don't sound like a bully by responding. That is not my intention, but I do want to say we do not have the ability to say to schools what law to follow or not follow. It is not a Lake County rule. It is a state rule because schools are state functions and they have their own boards. So to ask us to make that change is just not possible. Number two, I appreciate that Ms. Bono brought it up. I meant to correct Dr. Pace. He said there was only the CDC and the state guidelines for masks. We do still have our public facilities in Lake County mask mandate. I wanted to make sure and provide that in case there was some confusion that might have been taken away.
Thank you, Supervisor Sabatier.
And next is phone 1113.
Okay. Oh, there is another one? Okay. Let's see. If you're on, can you please unmute, and you have 3 minutes.
Yes, hi. Can you hear me? This is Dr. Will Tuttle.
We hear you loud and clear.
Okay, good. Yeah, so I want to respond to what we heard earlier, several things. The disinformation campaign, of course, I feel that this is what we're trying to do here is stop the disinformation that's coming from the captured agencies that have been captured over the decades by big pharmaceutical money and are causing devastating impact on our population. I really do agree with what some of you are saying, that the money, over $2 trillion in the CARES Act, virtually none of that went to actually educating people on how to eat healthy food, how to get proper exercise, how to get fresh air and have a positive life with healthy and happy and harmonious relationships. These are really the keys to health. Everything that's been done, all the money has gone into ramping up fear and alienation and having people wear masks. 70% of all the toxins in our body leave through our breath. And so you're going to be having people wearing masks, recycling their toxins, getting sick, locking down businesses has been a big problem, and keeping people separated. And everything has been to make people less healthy. We also have this ludicrous and very, I think, damning 2-week delay. So in other words, if someone gets vaccinated, then they're not considered vaccinated until 2 weeks later. And so you have all these people dying who have been vaccinated, but they're considered unvaccinated because most of the deaths happen within 2 weeks when people get this shot. And it's very toxic with the spike proteins and the graphene and all that stuff that's in there. So this is a very dangerous and damaging situation that we're in, and we have very reputable doctors and epidemiologists who have been censored and silenced, like Dr. Peter McCullough, who is one of the most respected people, always was, and in medicine, and he has these 5 truths, which I think I've sent it to you in an email, but I think it's very important to just be aware of that. The 5 basic truths. Number 1 is there is no such thing as asymptomatic spread of disease. This has been well documented and recognized for decades that healthy people do not spread disease. Therefore, there's no new evidence to refute this. So therefore, number 2, there's no need to wear masks. There's no need to practice social distancing, to close or limit schools or businesses, or to test people or to track people. Iceland, which is in the middle of a upsurge in cases, has just removed everything. There's nothing. They're not doing anything anymore because the Department of Health said it's the worst thing to do.
You can finish up, please.
All right, I'll stop there. Thank you very much, but I just think we need to question all of these things that we're being told. Thank you.
Thank you. Is there anybody else that has any public input on the Zoom? I don't see anybody.
There are no further hands up.
All right, so I will close public input at this point. We greatly appreciate your insight. We'll keep that in consideration. And again, thank you. Thank you, Director Portney, Dr. Pace, and Dr. McLaughlin for today's discussion, and we appreciate you. All right, so I'm going to go ahead and entertain a break. We will come back at 10:35, let's say.